Welcome to the Sage Women podcast, hosted by Melanie White and Dr. Nick Engera. We have real conversations with real women, health professionals, and coaches who share stories about perimenopause, menopause, and a range of women's health issues. Please subscribe so you get the latest updates every fortnight.
Hey, it's Melanie White here, and this is the Sage Women's podcast where we talk to experts, coaches, dietitians, and real people about menopause and all things related. And today I'd like to introduce to you Dr. Lydia Altini. Welcome to the podcast.
Hi, Melanie. Thank you so much. It's a pleasure to be here.
Thanks, Lydia. I really appreciate you taking the time. And I know that we're talking about the Australasian Menopause Congress today, but can you give us a little bit of a background about you, a bit of a bio, so everyone knows who we're listening to?
Yes, sure. I'm a GP. I have a passion for lifestyle medicine. I am a lifestyle medicine physician and a health coach. I have been working as a health coach for the last few years here in Australia, and I really am interested in women's health. I guess what I'd love to see more than anything is women being able to age well, to be strong women, maintaining their brain health as they age. And I just don't think there's any reason for us to fear aging if we are able to make changes to our lifestyle.
There's a lot of bad press around, isn't there, about aging?
Yes. And it's not for the faint-hearted.
Not something we can avoid either. Yeah, we could open a whole can of worms on that topic, but thanks for your introduction and background. I know you've done some really important and interesting work in your time as a doctor. Actually, could you tell us what you think is the most significant thing that you've done in your career before we get started?
I started out my career as a researcher in the microbicides area, which was a women's controlled method of HIV prevention. And we did amazing work in Cape Town in South Africa in that area. But since then, I would say that I've also really enjoyed working as a mindfulness facilitator. That has been incredibly rewarding, managing or facilitating mindfulness-based cognitive therapy and stress reduction programs, and then just educating people around how to change their health behaviors. It's just been so satisfying, so rewarding to see chronic diseases being reversed. Yeah,
a lot of people don't even realise that it's possible. They think that they have to take pills or that they're just going to fall apart gradually like an old decaying building that's had no maintenance, but it's actually not the case. It's just so interesting that so many people aren't aware of what they can do for themselves.
Exactly. Yeah.
Right. Well, Lydia, I know you attended the Australasian Menopause Conference over the last few days. Can you give us a little bit of background? What was it all about?
So it was in Queenstown. I was online, and the byline, I think, was remarkable reflections on midlife and menopause. And there really was remarkable. It was a gathering of mostly doctors and other healthcare professionals, obviously people who've got a special interest in women's health and menopause. And I think the focus of the conference was really to look at the latest research, to get everyone up to speed on the guidelines, the most recent management guidelines. It was a real privilege to be part of it. I felt very inspired.
It sounds fantastic, Lydia. It sounds like it was a very rich few days.
It was. There were incredible speakers, both international and national. The keynote speaker was a professor, Nick Panay from the UK, and he spoke on premature ovarian insufficiency. But the topics ranged from from early menopause to how to manage osteoporosis, stress, sleep, weight gain, and even how to manage menopause in breast cancer survivors. So yeah, lots of interesting topics, things that you wouldn't normally get to hear about.
And why was it important for you to attend personally?
Well, I'm working in the menopause, perimenopause and menopause space. I'm a consultant to Sage Women's Health, and we know that there really is a lot of there are a lot of knowledge gaps amongst women when it comes to perimenopause and menopause. There's also a lot of stigma. Many women don't feel comfortable talking about their symptoms with their peers. And so as a result, they might resort to going to look for information on the internet or getting it on social media platforms. And there's a lot of misinformation out there, a lot of confusion. So I feel that, like I say, working in the space as a consultant, I think we really need to be abreast of the current research. We want to be able to advise women on what's evidence-based and point them in the direction of reliable resources that are available.
It sounds like a very important point to make, in that you're saying that a lot of people aren't talking to their peers, and so then naturally they would be going online for information. And then what are the primary references to look for? What are the credible sources of information? Do they cover all of the needs, and do they cover the emerging research too? I suppose things I'm thinking about now as you're talking about it. What was most interesting for you, Lydia, at that conference?
Well, I'm going to touch on two things that I found most interesting. As I mentioned, the keynote speaker spoke about premature ovarian insufficiency, and he was also joined by Professor Amanda Vincent from Monash Health in Australia, and she spoke about early menopause. And I found those two talks really interesting because I wasn't aware, for instance, just how common early menopause is. It affects 1 in 12 women.
Wow.
And because and early menopause is menopause that happens to women before the age of 45.
Right.
So that's quite, for many women going through that at such a young age, they're going to feel so isolated because it's not something that's happening to their friends, to people that they might be socializing with. And it also puts them at much higher risk of health issues later on. So it increases their risk of heart disease, of osteoporosis, of dementia. So it's so important that it's diagnosed early and managed appropriately with the right treatment. And I think that, and as Professor Vincent actually mentioned, she said that it can take, in 25% of cases, it can take more than 5 years for a woman to be actually diagnosed properly, which is quite shocking when you think of the health implications, the chronic diseases that might happen later on with the delayed diagnosis.
Yeah, being able to understand and recognize that early means that you can intervene and perhaps slow the progression of some of those things.
Yes, yeah, and it affects women psychologically, psychosocially, as you can imagine. And I wanted to mention the two resources actually that Professor Vincent has been working on for women, and the one is where is that? That is the healthtalkaustralia.org, a really great website where you can actually go and read about women's experiences, which I think is so useful. And then there's also an app called askearlymenopause.org as well. So just wanted to make sure that that's out there for those women.
Thanks for sharing that, Lydia. I'll put those in the episode show notes so that anyone listening to this who's going through early menopause can have access to that, because it sounds like I can imagine that somebody who's 39 or 40 and going through early menopause might not understand what's happening to them.
Yes, exactly. Yeah.
And then perhaps not doing anything about it, or wondering is it a problem and who can help. It must be quite confronting. And even talking about that, so many women are having children later in life, and there's potentially a challenge there for women who've chosen a career or other things in preference to having children and are starting to think about childbearing.
Yes.
In mid to late 30s, and then confronted with the symptoms of early menopause.
Yes, I'm so glad you mentioned that, Melanie, because that in fact is one of the biggest concerns of women going through early menopause and premature in ovarian insufficiency is infertility. That comes up as the highest concern. Yeah.
So you mentioned this, the keynote talk, the opening talk of primary ovary insufficiency. Is that the sole first step toward early menopause, or are there other things that might cause early menopause?
Premature ovarian insufficiency is when women go through menopause before the age of 40. And early menopause is when menopause occurs before the age of 45. So they're slightly different. Premature ovarian insufficiency is, in most cases, it's probably genetic. But there women who may have had cancer as young women and have had to have chemotherapy or surgery will be affected.
Right.
And then there are some other risk factors as well. Smoking is a risk factor. Possibly being exposed to pollutants. So yeah, there are a few other risk factors.
Makes us really stand back and then look at what we've done through our lives, and even thinking about that, the fact that lipstick used to contain lead and all of those sorts of things, and paint used to contain lead, and all of the toxins that we might be exposed to, and through no fault of our own necessarily, as we learn more about how the body works and what impacts the expression of genes.
Yes.
And, perhaps the last 30 or 40 years has seen us exposed to a few things that might be outside of our control.
Yeah. Yeah, for sure. Yes.
I know you covered a lot in the Congress. What were a couple of key takeaways for you?
Well, the one thing that I would just well, as I said in the beginning, I'm a lifestyle medicine physician, and so lifestyle changes are my thing. And there was a wonderful presentation by Professor Belinda Beck, who is from Griffith University in Australia, and she spoke about the importance of exercise and strength training to increase bone mineral density, and there were some other talks about lifestyle as well. And so I would say that one of the key takeaways for me was the importance of making lifestyle changes as early as possible, really, but particularly during perimenopause and as we're going through menopause, to really protect ourselves, or perhaps I could say defend ourselves when we start losing the protective effect of estrogen. We really do need to be aware that we are, as we go through menopause, that we are going to be at much higher risk of heart disease, as I said, of osteoporosis, of dementia, and there's so much that we can do, and particularly as Professor Belinda Beck spoke about, and she has also got some wonderful resources on a website called healthybonesaustralia.org.au, that walking, yes, any kind of physical activity is going to be great. It's better than nothing. But if you want to actually grow your bone and prevent osteoporosis, then you need to be overloading it, which means that women, we need to be doing strength training. We need to be lifting those weights. So that was a huge takeaway for me. Yeah.
Anything else come up for you?
Yes. I was just so impressed really at what's been done in this space. The amount of work that's been done to, first of all, to find out what exactly are women experiencing. So there are some surveys that are being done. There's a registry called the Vital Registry that's, I think, started last year. Its aim is to collect as much information as possible from women all over Australia, to really understand their experiences of going through peri and menopause, so that we know how to support them. What do they need? In both in the community and in the workplace, and then just to become aware of the resources that are available out there to close those knowledge gaps, to provide education. And there was an interesting study that has shown that education in itself can actually help women manage their symptoms better. Just knowledge. Knowledge is power. Most certainly is. So yes, very inspiring to see the work that's been done, both from clinicians and from researchers, and that there are so many options, that no woman going through this phase of their lives with troubling symptoms needs to suffer. There are options for everyone.
I think that's where the gap is for everyone at the moment. It's this, firstly, nobody talks about menopause and symptoms, so we don't actually know what people are experiencing. But there's some great new research coming out that's talking about and unpacking those things. Yeah. And then it's, how do you bring the education to those women so that they know that they have choices? And then how do you help them not be overwhelmed by all of that and help them navigate that journey? And I think that's really an important part of the role that we have as coaches, to help people understand their unique circumstance, their unique options, and then to help them implement what's been recommended by a health professional.
Yes. Yeah. No, love that. You've summarized it beautifully.
Well, just as you were talking about it, I thought it really is a step-by-step journey, isn't it? It is closing each of those gaps in a step-by-step way to help somebody understand what their own options are, and for that person to feel empowered, that they know at least where to start and what their choices are.
Yeah, that's right. And it is an overwhelming phase of one's life. Not only are we dealing with these symptoms, but we are raising children and maybe taking care of aging parents and working, and there's so many things going on at this time of our lives. So the more support we can get, the better.
Yeah, some of us are running businesses, some of us are in leadership positions, and half as much sleep and half as much headspace and brain fog and all of those things. It's how do I actually keep my business afloat, or how do I maintain my position? Do I want to? What else do I need to do that requires more time, and what has to give in order to make that time? It's a lot for us to think about at this stage.
Yes. Yeah, so I agree with you. I think working with a coach is an incredible gift to yourself. Yeah.
Lydia, thanks so much for your thoughts on the Congress. Do you have anything else as a parting comment or tip?
I would say yes. Well, hopefully some of those resources that I mentioned will be helpful. But there are others. Jean Hales provide excellent resources. So I would say, educate yourself from credible sources, and if you need to see a health professional, just make sure that they have a special interest in this area, that they are well trained, because not everyone is. And you want to be given the best options for you for your unique situation.
Yeah, and as you were talking about that, I thought, I suppose, to add, if you're going to work with a coach, they should be certified by NBHWC or HACANSA in Australia.
Yes.
So that the coach you're working with is properly trained and able to refer as appropriate for things outside scope.
Yeah, absolutely.
Thanks so much for your time today, Lydia. It was lovely to hear about your takeaways from the conference, and thanks so much for sharing those links that will be really important for some people, and we'll pop those in the show notes.
Yeah, no, it was a pleasure. I really enjoyed chatting with you. Thank you so much.
Have a great afternoon.
Thanks. You too. Bye-bye.